Please welcome to the stage Dr. Goldie Byrd.
Good morning. It's my great pleasure to be here this morning. I want to thank Dr. Seal and the team for the invitation. I have one big gripe with her, and that is that she put me right after Dr. Satcher. And Dr. Satcher and I go way back. I was at Meharry when he was there as president. And I have to admit that my childhood sounds a lot like his. But I can tell you that I, too, am a product of the church. And that has indeed been a big factor in the work that we do at North Carolina A&T State University. So creating sustainable environments for healthy aging. This morning, I would like to share with you what my institution is. It is the largest HBCU in the country in Greensboro, North Carolina. It's a land-grant institution. It is a Carnegie Engaged classification, which I'm very proud of because our center helped them to get that. It is a STEM-focused campus, has 8 colleges, 9 PhD programs, 18 university centers, about 12,000 students, has a very rich civil rights legacy. And the reason I put this slide on is because I want you to know that we're not a medical school. And we are an HBCU, and we're located right in the heart of a huge African-American community. I just wanted to set that into some kind of context for your understanding about some of the challenges that we had, but also about some of the wondrous accomplishments that we've had because of who we are. So I'm going to talk to you just a little bit about Alzheimer's, about raising awareness, engaging and empowering communities, and motivating our people to action. As Dr. Satcher mentioned, Alzheimer's disease is the most common form of dementia. The primary risk factors for Alzheimer's disease is age, and that is, of course, late onset Alzheimer's, not early onset. And about every 6 to 6 seconds, someone else has Alzheimer's. It is one of the most feared diseases. There is currently no cure, no drug to slow the progression of the disease, no intervention to slow it. Once you have Alzheimer's disease, as we know it today, it goes in one direction, from bad to worse. It is the 6th leading cause of death in America. And more than 5 million people are living with Alzheimer's disease. If you look around this room, most of us are baby boomers, those people born between 46 and 64. And if you ask people to raise their hand, 1 in 8 of you will have Alzheimer's disease unless there is a cure or an intervention. Now, I didn't bring along the slide of the brain and what this disease does, but suffice it to say that what happens in the brain and what happens to us as we experience Alzheimer's disease is because of cells in the brain that are dying. And the hallmarks of this disease are plaques and tangles that accumulate in the brain. Now, the good thing about Alzheimer's in the past 10, 15 years is that it has become a part of our zeitgeist. In other words, we see it on the covers of magazines, we see it in the newspapers, and we hear more and more people talking about it. The Washington Post article on the right, quite frankly, is our article. And you can just Google it. I'd love for you to read it. It's a Washington Post article that came out this summer. So we are seeing more and more on the covers of all kinds of periodicals this disease because it is growing in America. We are living longer because of the wonderful work that people like Dr. Satcher and others have done. Because of the improved technology and medicines, we're living long, and we're learning more, and we're able to commit to working with our churches and other community organizations to make sure that people know about Alzheimer's disease and that families are able to do more about it, and so that's kind of where we come in as well. 1.5 times more Hispanics have this than whites, and blacks have this often as well, too often, and I'll share in a minute what I mean. I'll just put this slide on. This is a pedigree for those of you who do not do genetics, and I can't imagine that everybody does genetics, but these are some families that we've actually ascertained in our study. Just wanted to put up to show you that everywhere there's a dark circle or square, circle for women and squares for men, those are people in families who have Alzheimer's, who have had Alzheimer's disease, and so the point here is that this disease runs in families. So there are twice as much Alzheimer's in African Americans than there are. Is that where I am? I'm 10 minutes in? Or I have 10 minutes to go. Thank you. Thank you. So twice as much Alzheimer's in African American communities. So our big concern about 15 years ago is why was there so much Alzheimer's in African Americans? And as we've talked about, the social determinants are critically important, and we're finding out that more and more of the cause of Alzheimer's disease has to do with social determinants of health. But we wanted to find out what were the genetic factors involved in Alzheimer's disease. So we did this big search. And at that time, we looked into who was being published on Alzheimer's. And less than 0.01% of the papers that were published were on African Americans. And yet African Americans had the disease twice more. So we knew we had a problem, and we knew we needed to do something about this. And so we began this research project with Duke University to look at the genetics of Alzheimer's in African Americans. One of the first things we had to do was to understand what we needed to do to get into the community. And you know, the last thing we were going to do was go to a church and ask people to participate without getting help from the community and understanding what it would take to participate. So we began to prepare, and we did a huge research study with community just to find out what would it take, what were the barriers, what were the opportunities, and what the community needed for us to do. So the thing that we knew we could do, what we should do, was be disrespectful to the church. And when I say disrespectful, it meant going in, asking for something, and nobody knew really what we were talking about. And so we began to establish partnerships and simply raise awareness about the disease. Once we got into them, we did a huge study, over 500 participants with individuals intergenerationally asking the question. And the reason I put this work up is because often researchers, and I'm one of those, I'm a trained geneticist, we often forget to do the community work first, and that's a real big mistake. And so what I'm going to talk about in the next few minutes are the opportunities for us to connect with one another, connect with the church in a way that is sustaining. What does the environment look like if we want to conduct research or we want to conduct community or public health programs? What should it look like, and how should we approach it? So these are some of the kinds of things that we got. One of the big myths out there at the time we began this work was that blacks wouldn't participate in studies. And what we found in our study, and as a matter of fact, it aligns with other studies, is that blacks will. But there is a process. And again, this is an old African proverb. It says, until the story of the hunt is told by the lion, the tale of the hunt will always glorify the hunter. And so we needed to tell our own story. We needed to be able to tell authentic stories from our community, and we needed to share in an authentic way how to best do this work. So we began to just leverage messaging. I was a chair of Department of Biology and then a dean of Arts and Sciences. And guess what? I had access to all kinds of stuff. I had access to the radio, the television, the newspaper, and we began to pull together teams of faculty members who could help us just put true messages out there to the community about Alzheimer's disease, its ravages, and how to manage it. We did very similar things to what most people in this room are doing. Walks. We even engaged our band, the Aggie Marching Machine, dressed them up in purple and put out messages about Alzheimer's disease. We brought celebrities to campus, just raising awareness about Alzheimer's disease, people who had a vested interest in it. We also began recently book clubs, working with book clubs all over the country to raise awareness about Alzheimer's. And then we began to dig a little bit more deeply, and we began to talk to people around us. These are the kinds of people we began to talk to and ask the question, how can we partner? How can we best connect? If you're doing something in the community, how can this organization begin to connect with you and make things happen in a much broader way? So we began to, our recent stakeholders breakfast brought together a number of individuals who have huge interest in aging and Alzheimer's disease. And then again, we did work we began to do work in caregiving. One of the hardest diseases to provide care is in Alzheimer's disease. These patients require care, and eventually they will require care around the clock, and often they can require care for decades. So African Americans really struggle with the burden of this disease, both in terms of knowledge, literacy, management. The financial component of this disease is absolutely horrible. So we wanted to do more with caregivers. And this disease will break the bank, Dr. Satcher, unless there is an intervention. So 2 out of 3 of caregivers for this disease are women. And again, 2 out of 3 people who have the disease are women. So what that leaves us with, men, are you who will be our caregivers. And as a matter of fact, more and more of you are becoming caregivers, and over the last 15 years, the number of male caregivers for Alzheimer's has doubled. And so I won't go into the specifics, but folks in here who are caregivers know that you are impacted in many ways with this disease. So we began to, one of the things that our caregivers wanted us to do was to have an annual conference, and we do this. We started with 6 to 6 people. This year we were again over 400 folks at our caregivers conference. At that conference, we always gather information. We collect information so that we will know how to plan for the upcoming year and years to come. So we use every opportunity possible to collect data so that we can be for real, we can be true to the people that we serve. And again, we ask about church activities in our area, across North Carolina particularly, and we ask about the engagement of the church and what kinds of things you would like to see in your church around Alzheimer's disease. We profile our caregivers, and this is what we created at our center, the Center for Outreach and Alzheimer's Aging and Community Health, because of what caregivers have told us they need. And I can tell you the financial piece is always at the top of the list when we ask, how do we begin to prepare for this diagnosis? So then what they really told us they wanted was a space in the community that could be basically theirs, a space that they could come and they could provide, they could interact with each other, they could feel safe. So we created this center, a physical space for people to come to learn, to understand, to just decompress, to understand about how to care and how to manage. This is one of our rooms. It was built by one of our engineers. It has the toilet and the shower and all that, but we invite the community in to learn how to care for patients. We also began to publish our work early on. As we learned, we wanted the community to learn, so we published not only about the genetics research that we wanted to do. We partnered with four medical schools to get our genetics research done. But just as importantly, we published about what we found out about the community. And this particular article was the most published, was the most cited article over a 5-year period for that journal. We engaged the community. As you can see, we engaged our students. The next generation will be the generation that will probably figure out what's happening in Alzheimer's as much as we want it to happen immediately. So we certainly wanted to include our students. And I put this slide here so that you understand. We are at a university. The university is a wonderful, wonderful asset. So even if you're not in the same city as a university, they have social workers, they have nurses, and Pam talked about this in her session yesterday. Utilize the university, create partnerships with community colleges and universities as well as churches to help get messages across and help train and educate people about the disease of interest. I'm really excited about our Aggers Against Alzheimer's. We've got about 50 students now who wanted us to charter an Aggers Against Alzheimer's because they're either caring for their loved ones or they're sending money back home. It's impacting their retention and their graduation rate. So caregiving is huge among college students. And then we need to know about millennials who are caregivers, and they make up a huge portion of caregivers. We invite students, interns from our institution and other institutions, and they participate in very important projects. National and state level advocacy. Dr. Satcher talked about leadership, statewide leadership. We are in Raleigh, North Carolina, as well as in Washington, D.C., as well as in the city of Greensboro, talking to people and trying to make change on the policy level It's very important. We wanted the co-chair of the task force to create a strategic plan for Alzheimer's and dementia in the state of North Carolina. We were only one of 9 states that did not have one. And again, I use this example as a sustaining environment, an environment where no matter what our situation is, as Pam talked about yesterday, no matter what our church situation is, it's the importance of reaching out to community, to the assets that we have close by, very, very significant in getting our job done. I always want to acknowledge the people who do the work, all of our staff, our students, and all of our research participants who make our job much more exciting when we can actually do high-quality research on African Americans in a disease that mostly impacts us. All of our partners and our alumni. Our alumni have come together and they've created endowments for our center, and they will help to keep us going even when NIH doesn't. This is our team. We're very happy about them. Just want to play this. This sort of summarizes who we are at Coach.
I am so grateful. I might start crying, but I am extremely grateful for Coach because where I didn't have knowledge before as to how to relate to my mom, who is no longer my mom, she's become a patient. She's become someone I happen to love that I'm caring for, but Coach has given me skills, strategies, resources. I've been able to connect with other family members who are going through the very same thing, and some people who are further along. But just knowing that I'm not by myself, and it's been an outlet for me. It's a chance for me to share my feelings openly without being judged because other people are able to understand and they're going through the same thing.
And that's why we do the work that we do. I'd like to invite you to join our study. We're looking for families who have more than one person in a family with Alzheimer's disease, and our table is in the back. Thank you very much.